Welcome back to Living 808. Now, if you suffer from unsightly varicose veins, Vein Clinics of Hawaii can help. We welcome in Medical Director and owner, Dr. Randall Juliff. Hello. Thank you so much for joining us.
Thank you. Thank you for having me.
Before we talk about treatment, tell me, what is varicose veins and who typically gets it?
Well, who gets varicose veins and vein problems? It can be anybody. And actually, it's a very, very common problem. For instance, most adults in this country by the age of 50, of that group, 50% will have some form of what we call venous insufficiency. It's a little bit of a misconception that women primarily get vein problems, because we see it in plenty of men also. Probably 35 to 40% of our patient population are men. And actually, the most severe cases of varicose veins that at least I have seen in the past have actually been in young adult males.
Wow.
Like late 20s, early 30s. So, and we've treated people from age 16 up to early 90s.
Okay.
So it is literally anybody could have this process.
So what does it mean if someone has varicose veins?
Well, varicose veins and spider veins also. People complain a lot of spider veins. Varicose veins and spider veins are not the problem itself. Varicose veins and spider veins are usually a sign or a symptom of an underlying problem with vein function of the veins, the larger veins that are deeper in the leg that you don't see. Now, veins, as you might recall, are those blood vessels that carry blood back to the heart. Veins in the legs have sort of double duty. They've got to bring blood back to the heart, but they have to move it against gravity upward. The way that happens is that there are hundreds of little one-way valves inside the veins that keep the blood moving up. And the thing that happens when valves fail, or when veins fail, is the valves are failing. Usually it's a genetic sort of thing. It's something we inherit from parents, grandparents. And when those valves fail, the blood settles down into the lower leg and creates the symptoms. Symptoms of achiness, heaviness, fatigue, etc. And this is the process that we call chronic venous insufficiency. So varicose veins, the most popular thing that people know of, lay people know of, is just a product of chronic venous insufficiency.
Okay, that is so interesting because, you know, people who suffer from varicose veins, usually it's the aesthetic part that they're concerned about, or maybe they do have some pain like you mentioned, but what you're saying then is there's actually a deeper issue,
right,
a bigger
deeper
problem.
medical problem. Yeah,
Okay.
and that's the challenge that we have all the time, and that is that many people think that, gee, I've got varicose veins. Well, that's just a cosmetic issue. I don't really have to deal with it. Most of the time they should.
Okay, and again, that is called chronic venous insufficiency.
Yes.
So tell me about treatment. I've read that treatment has actually evolved quite a bit over the last 10 years.
Yeah, it has. Before 10 or 15 years ago, really the only way that we had to treat venous insufficiency and varicose veins is by doing something called surgical vein stripping, and a lot of people have heard of that. But that was a surgical procedure. People were in the hospital for 2 or 3 days, a bunch of incisions on their legs, and it was not a very palatable procedure for the patient or for doctors, quite frankly. But that has been replaced by newer technology that we call endovenous ablation. And endovenous ablation can be done either with laser fibers, radiofrequency catheters, several other things. But that's basically how we treat the process of venous insufficiency.
And is that a non-invasive treatment? Or
That is a minimally invasive.
Okay.
So, the procedures that we used to do, again, people were in the hospital 2 or 3 days. Currently, the procedures that we do are all performed in the office. Okay. We don't make any incisions. Everything we do is just through little needle puncture sites. And people have their procedure and leave the office and go on with their day. It's incredibly less traumatic to the patient than it used to be.
Yeah, and that sounds so much better.
Oh yeah,
right?
much better.
Yeah, and then do these veins then just disappear? These unsightly varicose veins?
The more superficial veins, that's sort of the second step. Now we do that at the same time, but in addition to taking care of that underlying problem, which is the ablation procedure, then we have to get rid of the superficial veins, and typically we do something called microphlebectomy, which again is done just through little needle puncture sites, but through those sites we're able to get out the bulgy veins and you know, make the person's leg look quite a bit better.
Yes. Doctor, thank you so much. I know a lot of people suffer from this, so it's an interesting topic. And I know that you said a lot of big words that people may have missed. So really the best way is just to go and see you, make an appointment, and have a consultation. Where are you located?
We're on Veritania Drive.
Okay.
And yeah, or please visit our website, veinclinicsofhawaii.com, and we actually have a virtual vein screening on the website.
Great.
That will give everybody an idea as to whether they need to worry about this or not, and certainly they can call anytime, absolutely.
Okay, doctor, thank you so much.
You're welcome.
Thank
Pleasure.
you.